Hi, everyone. Thank you so much for joining today's PSYCKES for Health Homes and Care Management Agencies webinar. My name is Michelle Rahm. I'm a research scientist on the medical informatics team, and I'm joined by my colleague Miranda Long, who's also a research scientist within the Bureau of Program Research and Evaluation, and we work within the Office of Population Health and Evaluation. So we'll both be leading today's training webinar. So before we get started, I did want to point out that all of the phone lines have been muted to help prevent any background noise, but you can still ask your questions during today's webinar by accessing the Q&A box in the WebEx menu. And you can get to that by going to the three horizontal dots on the bottom right-hand corner of your screen and selecting that Q&A option. When you're using that option, just make sure to submit to all panelists. And we want to note that we won't be monitoring the chat function today for Q&A, so just make sure you're only submitting your questions to the Q&A feature. And I wanted to make a note here that if you have any questions about a specific individual that you're working with, and if they're showing, for example, a discrepancy in the PSYCKES application that you wanted to get that looked at, you can reach out to our PSYCKES help desk for any member-specific questions. And I'll have Melanie or Ashma put that into the chat, our PSYCKES help desk email. Today's webinar is more so like a general overview of the PSYCKES Health Home Plus features and the Health Home Plus Tableau. So any member-specific questions, we'd be happy to answer and investigate further using our PSYCKES help desk email. And lastly, we will be sending out the slides and recording link to all attendees after the webinar, and it will also be posted to our public website very shortly. And like I said, we have my other colleagues, Melanie and Ashma, on the line. They'll be helping to monitor the Q&A box while we go through today's training. All right, so here is our agenda for today. We'll start off with the Health Home Plus Tableau, and we'll do a brief overview of that Tableau, and then we'll go right into a live demo of all of the things the Health Home Plus Tableau has to offer. And then we'll switch over to our PSYCKES portion of today's webinar. We'll do a very brief overview here since I'm sure many of you are already familiar with PSYCKES. And then we'll dive into the PSYCKES Health Home Plus eligibility key considerations. So just some things to keep in mind when you're using PSYCKES or the Health Home Plus Tableau to find individuals who are eligible for Health Home Plus. Then we'll go into the different screens in PSYCKES. So we'll have population health with recipient search. So I'll show some filter options you can use there. We have accessing client level data. So how to get access to that clinical summary and the different access levels that are available. Then we'll review client level details within the clinical summary. And we'll go into quality improvement with my QI report. And then we will end on training and technical support, and we'll be answering your questions at the end of the webinar. So after that training and technical support piece, we'll go into the Q&A portion. All right, so with that being said, I'm going to pass it over to Miranda here to go over the Health Home Plus Tableau overview.
Thanks, Michelle. Good afternoon, everyone. Thanks for being here. So the Health Home Plus Tableau is currently published on PSYCKES. And if you are unfamiliar with Tableau, it is a data visualization software that allows users to interact with data. So we have several different types of reports on the Tableau that you can interact with and choose different data pieces to look at, such as a health home specifically, a CMA specifically, or other types of data. The Health Home Plus Tableau is currently located within the PSYCKES dashboard module, which I will show you in just a few minutes. Data in the Health Home Plus Tableau is using the same data that's available in PSYCKES. However, the aggregated, so there could be differences in the data that you see in the Tableau compared to what you see on the individual level in PSYCKES because of the differences in timing of the data that we have due to the processing time it takes to get the data from the original sources processed through our measures into the Tableau. And it is great that the Health Home Plus Tableau is on PSYCKES because you can then look up individual level data in PSYCKES after you've looked at something in the Tableau. So if you have a question about a specific individual, you can go straight from the Tableau back into the individual level in PSYCKES. The Health Home Plus Tableau is updated monthly, with a 3-month data lag to allow for complete availability of data. The data tends to fluctuate up until that 3-month point. So our data is available 3 months behind currently. So the update this month will show you July data. And that will be available later this week, likely tomorrow or Friday. So you can view the Tableau then to see the most up-to-date data. So I will now walk us through what's available in the Tableau on PSYCKES. Okay, so when you come into PSYCKES, you will go over here to the right and click on this Dashboards tab, and then Health Home Plus. And this will bring you to the Health Home Plus Tableau. So these are the available dashboards we have here along the top: program info, how to use, New York State overview, trends over time, health homes and CMAs, MCOs and health homes, and frequently asked questions. I'll go through each of these and give a little bit of information about what they are and how to use them. So first we have this landing page, program info. This is where you will come anytime you open the Tableau. It should be the first thing that comes up. And it just gives a little more information about what Health Home Plus is here. You can also see that there's a link to the Health Home Plus webpage on the OMH website. It gives you a little bit of information about the data dashboards we have and where the data comes from. There is also a note here talking about the data lag that I mentioned previously. The latest reporting month is 3 months prior to today to accommodate some data lag. And down here at the bottom, you can see the last time the data was updated. So September 16th was the last time the data was updated, but as I mentioned, it should be getting an update later this week. So it will be showing data up through late October. And then this button over here, if you click on this email icon, it will allow you to email our help desk, dataofi@omh.ny.gov. If you have any questions while you're using the Tableau, any questions about the data or how to use the Tableau or features that are on each of the dashboards, feel free to email that email address and we will be able to give you some more information and answer your questions. So this first dashboard, how to use the Tableau, gives you a lot more information about the metrics that are available on each of the dashboards. It goes through each one. So I would highly recommend reading this if you're interested in where the data comes from for each one or what's specifically available on each dashboard, but I will be walking through each of them. You can also see more information about SMI guidance up here. There's a link to that information as well. So this first dashboard is called the New York State Overview. There's no interactive elements on this dashboard. It just provides an overview of a few statewide metrics you may be interested in looking at. There's an overview for the number of Health Home Plus eligible individuals, the number of Health Home Plus enrolled individuals, the number of specialty mental health care management agency enrolled individuals, and the number that were provided Health Home Plus level of service. And you can see all of those either in number form up here across the top, in number form in the line graph at the bottom. And you can also see the percentage here. And these percentages will be out of the number of Health Home Plus eligible individuals. And if you ever need a little more information about what specifically you're looking at, you can hover over many of the points or bars on dashboards and get a little more information. So it should give you sort of a written explanation. As you see here, for New York State in April 2025, there were 26,883 individuals who are Health Home Plus eligible. So a lot of times hovering over something will provide you with a little more information that may be helpful. And for this dashboard specifically, you can see back up to a year prior to when the data is currently available. So for the next dashboard, trends over time, there is a lot of information on this dashboard. So there are 3 graphs here, and this dashboard is interactive and it uses a set of filters to allow you to change the data that you can see in the graphs. So first, you would select whether you're interested in looking at a care management agency or a health home. So let's look at a care management agency first. And then you'll select the care management agency that you're interested in looking at. So you can change the care management agency you're looking at, and it will change these the first graph and the last graph. So the first graph is showing you the number of individuals that were provided Health Home Plus level service here in this black line, and the number of Health Home enrolled individuals in this gray line. And it's for Addiction Center of Broome County, CMA. So you can see all of that information here in this top bar. And again, if you hover over points, you can see specifically what you're looking at. And it'll give you a little more information and sometimes help you differentiate when the lines get a little bit closer, or you're not sure which point you're looking at. You can also click on them and it should highlight them as well. Same thing here with this bottom graph. It's just going to show you the percentage. So the number provided Health Home Plus level of service over the total number of Health Home Plus enrolled individuals. And so it'll give you that percentage here in the green line for the Addiction Center of Broome County. And then that is compared to New York State here in the purple line. So the purple line will always be here giving you the comparison group that you've chosen. So that's this first filter. The second one here, you can choose between New York State or you can choose another region in the state. So say that you want to compare to the rest of Central New York. That will change a couple things here. It will change what's in this middle graph, and it'll change that purple line here in the bottom graph. So in the middle graph, you can see the number that were provided Health Home Plus service in black, and the number that were Health Home Plus enrolled in gray, and that is for Central New York. So a lot of these titles are color coded to help you see what you're looking at. And again, the tooltips when you hover over points can be helpful to sort of differentiate which point you're looking at and which metric you're looking at. So if you change a number or a choice in the numerator, you can see either specialty mental health care management agency enrolled or the number provided Health Home Plus service. So that'll change all selections in the graphs for all 3 graphs. So then you can see now it's changed to specialty mental health care management agency enrolled, and it still has Health Home enrolled here. So that's where you would change the denominator. But your available denominators are Health Home enrolled and SMH-CMA enrolled. So when you choose SMH-CMA, you can only choose Health Home enrolled as your denominator, and vice versa. So there's a lot of different information you can look at here. You can change your comparison group here in the middle, and you can choose any CMA or Health Home. So just to show you, when you change to a Health Home or you change back to CMA, sometimes it can look like this, where there's no data in these graphs. So what you would need to do in that case is check your filters and see if it's in parentheses like this, that's no longer an option. So you would just need to choose a different metric here, either change back to CMA or pick a Health Home. And now everything shows up. Just something to note. So again, same options with looking at this by Health Home. You can change your comparison group here. You can change your numerator and denominator, and it should change what you see in the graphs here. And then you can go through and look at the metrics over time. So you can choose your CMA or Health Home. You can look at New York State or a region compared to your CMA or Health Home on this graph. There's a lot of different information and different ways to look at it. So the next dashboard here is health homes and CMAs. And this dashboard has Health Home Plus information for a health home and all of the associated CMAs, or for a CMA and all the associated health homes for a chosen month. And this data can be viewed as a percentage or as a number. And if you're looking at it by percentage, the percentages available will be the percent that the CMA identified as Health Home Plus eligible and the percent that received Health Home Plus service. And those are out of the total number of Health Home Plus eligible individuals. And then if you switch over here to the numbers view, you can see the number of Health Home Plus eligible members, the number of CMA identified Health Home Plus eligible members, and number of individuals that received Health Home Plus level of service. So this functions similarly to the trends over time, where you can choose one or more health homes or CMAs to look at. So if you want to look at a health home specifically, you can pick just one health home and it will show you all the associated CMAs at the bottom. Or you could choose multiple health homes if you wanted. If you work with multiple health homes, you could choose as many as you want here. So you can see all those health homes that were chosen, as well as the associated CMAs down below. Or you could choose CMAs that you wanted to look at, and it will show you the associated health home. Again, you could choose as many as you wanted, or you could just look at one at a time. And again, there are tooltips on this dashboard as well. So if you hover over a point, it can give you a little more information about what you're looking at. And if you decide that you want to look at the numbers instead, you just click on this button up top to take you to numbers. And then if you want to go back to percentages, you just click percentages. You can also choose a different month. So here we're looking at June 2025, but if you wanted to go all the way back to February 2023, you could do that. You could choose any month here and it will give you the information that's available for that month. Just one other thing to note here. Say you had picked a couple of health homes and you wanted to go back to all. You can also click this button, click to reset, and it'll reset the view. It'll set you back to all health homes and all CMAs, and it will stay on the same percentages or numbers that you've chosen. So this is another way to sort of drill down to your specific health home or CMA and get a little more information about that specific health home or CMA, or all the CMAs associated with a certain health home. Okay, so MCOs in health homes functions very similarly to health homes and CMAs, the tab we just looked at. The difference is just that you can see MCOs in health homes rather than health homes and CMAs. So similarly, you could choose any number of MCOs you wanted to look at, and it will show you all the health homes associated with that MCO. Or you could look at any number of health homes you were interested in, and it would show you all MCOs associated with that health home. And on this tab, the percentages that are available are the percentage that are a health home enrolled, the percentage of individuals that the CMA identified as Health Home Plus eligible, and the percentage of individuals that received Health Home Plus level of service. And again, that percentage is based on the total number of Health Home Plus eligible individuals. Again, you can also look at numbers on this dashboard. You can look at the number of Health Home Plus eligible individuals, the number of Health Home enrolled individuals, the number of CMA identified Health Home Plus eligible individuals and the number of individuals that received Health Home Plus level of service. You can also go all the way back to 2023 here. You could select any individual month and say again that you had chosen a couple of MCOs and you were trying to get back to see all the available MCOs and health homes. You can use this click to reset button and that will reset the view so you can see all MCOs and all health homes. And again, you can hover to see the tooltip to get a little more information if you need it. So those are all of our data dashboards. And then we have this last tab for frequently asked questions. This includes a couple of questions that we get frequently, including looking at individual level data, which you can do in PSYCKES, how often this report is updated, the data lag that I mentioned earlier, and a couple of other things. But if you do have any other questions, I'm happy to answer questions during the Q&A portion, but also if you're using the Tableau on your own time and you have a question, just remember you can click this button right here and email the Data OFI Help Desk, and we'll be able to give you some additional information about any questions that you may have. So that's what we have for the Health Home Plus Tableau on PSYCKES. And as I mentioned, I'm happy to answer any questions that you may have at the end, but I will pass it back to Michelle for some more information about PSYCKES.
Great. Thank you so much, Miranda. That was so helpful to get a live demo of the Health Home Plus Tableau. So thank you so much for doing that. All right, we will pivot back into PSYCKES now. Let me pull up my screens. And we'll do a brief PSYCKES overview. So switching over to PSYCKES related data, we have PSYCKES, which is a secure web-based HIPAA-compliant application. And this integrates multiple data sources to help support population health, quality improvement, care coordination, and clinical decision-making. So right now, PSYCKES has over 10 different health-related data sources feeding into it. Our main data source is Medicaid billing, but we also have data sources coming from other state databases. So we have EMR data from state PCs. We have data from New York City, which includes Rikers information, Department of Homeless Services, DHS data, DOHMH data, etc. And then we also have state OMH data. So this includes things like AOT. We have suicide incidents coming to us from NIMERS, CARES data on living and residential support services. And lastly, I want to point out we have provider and recipient entered data. So this includes entering in information on psychiatric advanced directives or PADs, attaching a safety plan to a client's clinical summary, rating scales, which includes the suicide screening, CSSRS, and the depression screening, which is the PHQ-9. But providers and recipients can enter in data for a client's clinical summary, anything that they think is relevant to their treatment, like a discharge plan or a relapse prevention plan, among others. And we have over 12 million individuals viewable in PSYCKES. So this includes folks with a history of Medicaid-funded behavioral health diagnosis or treatment, or state PC inpatient or outpatient services, or individuals with health home outreach or enrollment. So that was a brief PSYCKES overview. Now I want to go into PSYCKES Health Home Plus eligibility key considerations. So these are things to keep in mind when you're using the application to identify those Health Home Plus eligible individuals. So there are two ways to identify Health Home Plus eligibility in PSYCKES. The first is with our Health Home Plus eligible high need population filter, and this exists in recipient search, and it's updated on a weekly basis. We also have a notifications message indicating Health Home Plus eligibility in a client's clinical summary if they meet criteria for any of the PSYCKES algorithm Health Home Plus eligibility criteria. And this notifications message is updated on a monthly basis. So the two things these have in common, the high need population filter and the notifications message indicating Health Home Plus eligibility, is that they both use the PSYCKES algorithm alone to identify that Health Home Plus eligibility. Now we also have Health Home Plus eligible quality flags. So those are available in recipient search, My QI report, and statewide reports, and in the client level clinical summary. Now our quality flags are different from the bullet above because these use the PSYCKES algorithm and map to identify Health Home Plus eligibility. So different data sources for both of these. And then these quality flags are updated monthly. I added a slide here to just explain what the PSYCKES algorithm means when identifying Health Home Plus eligibility. So we've listed out the algorithm criteria here. We have AOT, active court order or expired in the past 12 months, or ACT discharged in the past 12 months. We also have 3 or more inpatient mental health or 4 or more ER mental health visits in the past 13 months. Then we have 3 or more inpatient medical and schizophrenia or bipolar diagnosis in the past 13 months. We have an ineffectively engaged criteria, which includes no outpatient mental health in the past 12 months and 2 or more inpatient mental health or 3 or more ER mental health visits. Then we have state PC inpatient discharge or Health Home Plus eligible CNYPC release in the past 12 months. And one of our newer criteria we've added to help align is the homelessness in past 6 months with a DOH serious mental illness SMI diagnosis in the past year. So right now, this is our PSYCKES algorithm Health Home Plus eligibility criteria. So whenever I refer to the PSYCKES algorithm, these are the criteria that I'm talking about. Now, I added a slide here to describe our PSYCKES Health Home Plus eligible quality flags and the numerators and denominators. So right now we have 4 eligible for Health Home Plus quality flags, and I just want to touch on each of these briefly. We have in the first row, eligible for Health Home Plus, not Health Home enrolled. Now, in the far right column, the denominator, we're looking at Health Home Plus eligible adults according to either our PSYCKES algorithm in the past 12 months or according to MAP in the past 3 months. So out of that bucket of Health Home Plus eligible adults based on our algorithm or MAP, who is not enrolled in a health home according to MAP? That's what that first measure captures. The next row is eligible for Health Home Plus, no Health Home Plus service past 12 months. So the same denominator here, and this is looking out of that bucket of Health Home Plus eligible adults who has not had a Health Home Plus service in the past 12 months according to either Medicaid billing or MAP. And then below that, we have a more real-time measure for this. It's looking at who has not received a Health Home Plus service in the past 3 months, according to either Medicaid billing or DOH MAP. So 2 different look-back periods available. The last measure on the screen is a little bit different. The denominator looks at the Health Home Plus eligible adults, according to our algorithm or MAP, who are also currently enrolled in a health home. Now, out of those Health Home Plus eligible adults enrolled in a health home, who has not been identified as Health Home Plus eligible in MAP in the past 3 months? So these capture our 4 different Health Home Plus eligible quality flags in the application. Now we have our key considerations here, just things to think about when you're using these Health Home Plus eligible features in PSYCKES. Our recipient search Health Home Plus eligibility filter, it uses our PSYCKES algorithm alone to identify those that are Health Home Plus eligible, and it's updated weekly. Now we have our quality flags I just went over. Those capture Health Home Plus eligibility using both the PSYCKES algorithm and members that are MAP identified as Health Home Plus eligible. And these quality flags are updated monthly. So sometimes folks might see a discrepancy in the numbers when running a search using that high need population filter versus a quality flag search for Health Home Plus eligibility. And that's because of the different data sources we're pulling in, PSYCKES algorithm for the filter, and then the algorithm and map for the quality flags, and the different update periods. So updated weekly versus updated monthly. The last bullet here just talks about the MAP OMH Health Home Plus eligible flag. So right now we send a weekly feed of our Health Home Plus eligible PSYCKES algorithm population. We send that to MAP weekly, and MAP updates their system on a monthly basis. So sometimes we get questions about why somebody isn't showing as flagged in MAP as OMH Health Home Plus eligible, and that could just be due to the different timing and refresh periods. So we send it over weekly, but MAP updates on a monthly basis. And then we have a chart here just identifying the differences between our PSYCKES Health Home Plus features versus the Health Home Plus Tableau features. So we have in the first column for our PSYCKES Health Home Plus features, we have our high need population Health Home Plus eligible filter. It's updated weekly. And then our Health Home Plus eligible quality flags and Health Home Plus eligible notification message in the clinical summary, those are updated monthly. So for the Tableau, that's updated monthly with that 3-month lag to allow for complete data to come in. So we have a note at the bottom of this chart just as a reminder that there's a difference in the timing of our data refreshes between PSYCKES and the Health Home Plus Tableau. So that might be why you see a slight discrepancy in the numbers. The next row, it just identifies that our high need population Health Home Plus eligible filter and that notification message in the clinical summary for Health Home Plus eligibility, those use just the PSYCKES algorithm alone to identify Health Home Plus eligibility. But our quality flags again use our algorithm plus DOH map. And the quality flags do match the Health Home Plus Tableau because the Tableau uses both our algorithm and PSYCKES and DOH map to identify Health Home Plus eligibility. And then the last row is just a note that in PSYCKES you can view both aggregate data and drill down to recipient level data, so the client level clinical summary, when you have the appropriate access like consent or emergency access, whereas the Tableau is just aggregate data only. All right, so those were some of the key considerations. Now we're going to move into population health with recipient search. So I want to explain how clients are linked to your agency in recipient search. It's if your agency has billed for that client in the past year or if they're currently linked to you through MAP. So that's how folks are linked to your recipient search screen. And we can use recipient search for both an individual client or group cohort search. So we've added some examples here of filters that you can use to run a search that might be of interest to you. So we have our Health Home Plus eligible high need population filter. I'll show where that is. We also have our complex needs filter, which is a relatively newer filter. You can search for clients that you're serving that have experienced homelessness, shelter or outreach homelessness, if they've had any alerts like a suicide attempt or ideation, or if they've had an opioid overdose. And then quality flags, you can search in recipient search for any of the quality flags that we have available in the application. And then service settings. So for example, you can see who is being served or who is health home enrolled at your agency, or who is health home enrolled at any agency within New York State that you're serving, or who's receiving CMA services at any agency in the state that you're serving. You can also see who's received Health Home Plus services here. And on the results page, you can export to Excel or PDF. And we also have advanced views, which are like our bulk population management views, we call them. We have care coordination, which I'll show an example of. We have high need, high risk, hospital utilization, and outpatient providers. So here is the recipient search screen. At the top of the purple navigation bar, you can see we've landed on the recipient search option here. And the top of the page, I want to point out, is really meant for an individual search. So you can use that recipient identifier section to search for one single person using their Medicaid ID, their social security number, or their name and date of birth. Everything below that is meant for a group search. So you can search by their characteristics, social determinants of health, or a special population, medications or diagnoses, quality flags, etc. So the top is for an individual search and the bottom is for group search. And we have an arrow pointing to the top right, limit results to. If you run a search, for example, for Health Home Plus eligible individuals that you're serving and the results are 100, and you don't change the limit results to drop down here, your results page will only show the first 50 client names. So if your results go beyond 50, I recommend just editing the limit results to column to a number higher than 50 so you can see everybody on the results page. Now I'm going to go through a couple sections of the recipient search screen. So first we come down to the special population section. So here we have expanded the high need population dropdown, and highlighted here, this is where you'll see that Health Home Plus eligible filter. Now, just as a reminder, this is using our PSYCKES algorithm alone to determine that Health Home Plus eligibility and is updated weekly. But we also have our other Health Home Plus eligibility criteria here that our algorithm runs. So we have towards the top, homeless in the past 6 months with DOH SMI in the past year. You can look for folks who have active AOT or those who have 3 or more inpatient mental health or 4 or more ER mental health visits in the past 13 months. And you can scroll down and see the other PSYCKES algorithm Health Home Plus eligibility criteria here as well. Next is the alerts dropdown, so you can select that top option, alerts any, which will pull up individuals you're serving that have had any of the alerts below, or you can select a specific alert like OMH unsuccessful discharge or overdose opioid to search for a specific population that experienced that alert. Next is our homelessness alerts dropdown. So this is a different type of filter we have in the application where it's a multi-select option. So here you can select up to 4 different homelessness alerts, and we have homelessness data coming from the Department of Homeless Services, New York City Department of Homeless Services, or from Medicaid billing Z code. So you can either search using both of those sources at the top or specifically for DHS homeless information, and below that for Medicaid related homeless information as well. And it uses an OR logic, so when you select more than one, it'll look for example, in this example, it'll look for any past 1-year DHS or outreach past 1-year DHS. And then our complex needs dropdown. So there's a lot of criteria that completes the complex needs definition. So here at the top, you can either select what's selected here, which is any complex needs, meaning this will show on the results page folks who have any of the criteria listed below, or you can select up to 4 different specific criteria for your search. So another multi-select filter option here. And then we have the social determinants of health section. So here you can see on the top left-hand side, we have our SDOH domains. So these are the bigger categories here that you can actually click on the little minus sign, and it will open up that category to show subcategories or SDOH conditions. So you can search using a SDOH domain or a specific SDOH category, and you can select up to 4 different criteria here per search. Something you could do is search for sheltered homelessness, for example, or unsheltered homelessness, and this is coming from the Medicaid billing Z codes. Next, we have our quality flag section, and just as a reminder, at the top, this is the as of date, and it's updated on a monthly basis. You could also go to the right and click on the definitions hyperlink and actually export that to PDF just for future reference on the definitions of our quality flags listed here. So I've highlighted the Health Home Plus eligible quality flags that we have available in the application, but there's a very long list here of different options you can use when searching for measures. And if you hold the control key down, you can search for up to 4 quality flags per search. And my last note here is just as a reminder, these use both our algorithm and map to identify Health Home Plus eligibility. They're updated monthly. So moving to the bottom right of recipient search, we have the services by any provider section. So here I want to point out in the service setting box, you can actually expand the service setting categories to reveal subcategories within them. For example, we've expanded care coordination here, and here's where you can search for folks that you're serving that have received for example, care management or health home services from any other provider in New York State. In this same box, you can also search for high utilizers that you're serving, and that's done by going to the service utilization dropdown. You can select a service type like clinic, mental health all, or an ER service or inpatient service. Once you select the service type, you can use the number of visits dropdown. So here in this example, I can search for folks I'm serving that have had an ER behavioral health diagnosis, service, or CPEP visit, and I can go up to 20 or more visits in the past year. So it's a way to search for individuals you're serving that are considered higher utilizers. So here's an example recipient search report that I run. So I've looked at the Health Home Plus eligible filter. I've applied that to my search. And here I'm logged in as Main Street Health Home. So I can see there's 436 Health Home Plus eligible individuals that I'm serving based on that PSYCKES algorithm. So the PSYCKES algorithm criteria that I showed earlier. Now, what you can do here, we can see the name, we can see the Medicaid ID and date of birth, the gender, the race and ethnicity, any quality flags they meet criteria for currently, their Medicaid managed care plan, their current PHI access, whether you have access or you don't have access. And then in the right-hand column, if you don't have access, you can enable access here as well. So what you can do if you do have access to the clinical summary, you can drill in and see what Health Home Plus eligibility criteria they're meeting. You can also export to PDF or Excel this list of individuals, or you can change to an advanced view. So my arrow is pointing to the eye here in the view dropdown. So if you click on that eye, you'll see a pop-up explaining what other columns will be displayed with the specific advanced views that we have to offer. So today I'm going to select the Care Coordination Advanced view. And once I apply that filter, you can see that now there's a scroll bar at the bottom of the page, and I can scroll to the right since additional columns have been added. So if I scroll over, I can see these Health Home Plus individuals that I'm serving. What are their HARP statuses if they have one? Are they eligible for CORE? Do they have an HARP HCBS assessment date? We have K codes here. If they're enrolled in a health home or care management agency, you'll see the name of that health home or CMA. ACT provider information if they're actively receiving ACT services, or if they're on track enrolled, you'll see the on track information. Then lastly, you can see AOT status if they have an active court order or they're expired in the past year. Or if they're actively on AOT, you can see the provider information as well on the far right. And you can also export this advanced view to Excel. All right, we're going to move along to accessing client level data. So clients can be linked to your agency two ways: automatically, meaning the client had a billed service at your agency within the past 9 months, or they're currently enrolled in your health home or CMA according to MAP. So that's how clients automatically get linked to your agency. Now you can also link them manually by attesting that they signed a PSYCKES consent, a DOH Health Home Patient Information Sharing consent, or the BHCC consent. You can also attest if they've given verbal consent, or if there's a clinical emergency, or if the client is currently being served by or transferred to your agency. So those are our options for manually linking a client to your agency. Now, just to go into these a little bit further about what level of access you get from each option. For the signed consent option, this includes the PSYCKES, BHCC, and DOH Health Home/GCO consent. This allows access to all available data, and that includes that data with special protections. So data with special protections is substance use information, HIV, family planning, and genetic testing. So you get access to all available data for 3 years after their last billed service. So if you continue billing for them, that 3 years will continue to renew. Next is verbal consent. So this is a little bit different. You can get access to the clinical summary, but with limited data. So you do not get access to that data with special protections. but you do get access to the clinical summary for 9 months. Then we have clinical emergency access, and this allows access to all available data, including data with special protections for 72 hours. And then lastly, attestation of service. This just means the client's currently being served by or transferred to your agency. So if you attest to serving the client in the Enable Access module, it'll link the client to your recipient search reports, but it will not provide access to the client's clinical summary. And then I have a slide on the DOH Health Home Consent logic. So this includes the 5055 and 5021. So clients can sign a DOH Health Home Consent, and this covers staff who either work for a health home or care management program according to MAP, or we also have recently enabled this to work for CCOs, care coordination organizations, providing health home care management within OPWDD, and have billed at least one CCO case management service in the past year. Now, once that criteria is met, the checkbox can be enabled once you update your user role profile to indicate you work for either a health home administration slash CCO or the care management program. So once you do that, you should be able to check off that box in the application. And then access will stay active as long as the client's health home or care management enrollment is verified in MAP, and there's a 90-day grace period after entry into PSYCKES. So I'm going to go through the Enable Access module. So the first thing you want to do is search for a recipient using the recipient identifiers section. So we have a search option for Medicaid ID, Social Security number, or name and date of birth. In this example, we're going to search using Medicaid ID, and I'm going to click search. All right, now we're going to confirm the client's a match on the results page. So I searched using their Medicaid ID. I'm just going to double check their name, their age, their Medicaid ID number, their date of birth and race and ethnicity, and their address. I just really want to make sure that this is the correct person I'm about to enable access for. Then I can tap the Enable Access button. And now the Enable Access module pop-up will appear. So here I can attest to the client signing consent. In this example, we've checked off the DOH consent form option, but you can see the other options listed here as well. If you ever are unsure of what the options mean, there's an About Access Levels link on the upper right, which will show an explanation of each access level shown here. So once I select DOH consent form, I can click Next. This is where I just want to triple check this is the right person I'm enabling access for. So double check the unique identifiers, the date of birth, and the address, and then attest to how I know this is the correct person. I can either attest to the client's identity myself or advise that the client provided one photo ID or two forms of non-photo ID. Now what you can do is cancel out if you realize, this isn't the correct person or you don't want to enter consent. You can click enable, which will bring you back to recipient search, but still enable this person's access level that you've selected, or you can enable and view the clinical summary here. And then this is just a screenshot on what an updated consent looks like. We just entered one in for Jane Doe. We've entered in that DOH Health Home consent. So now you can see her name is clickable and the current PHI access column shows Health Home consent. All right, moving right along. Now that we've enabled consent, let's go over the clinical summary details. So the PSYCKES clinical summary, it summarizes up to 5 years worth of treatment history for a client. And what it does is it takes all of the data that we're receiving from Medicaid billing and other state databases like state PC EMR data, MAP information, NYMERS information, TACT, CARES, DHS information, takes all of that data and summarizes it into treatment episodes to really help support a rapid review of a person's treatment history. And these episodes are linked to dates of service, so you can drill into a specific episode and view more information on diagnoses and procedures associated with it. And we've organized the clinical summary by sections, just like an EMR. So I'll show the different sections we have in the clinical summary here. I won't go over all of these, but today I'll definitely be touching on a few of these clinical summary sections that might be important to the work you do. So here's an example clinical summary. The information is scrambled because we're on a training, of course, but at the top you'd see the person's name. Underneath that, you'd see the as of date. So this clinical summary, the clinical summary information is updated on a weekly basis. Right now, we're on the brief overview, which is like a snapshot of the person's clinical summary, again, to help support that rapid review. And then you have the general information. So that includes the date of birth, the address, their managed care plan, and their HARP status if they have one. If they have a Medicaid eligibility expiration date, that would show there as well. And then below that, the current care section, we call this the who do you call section because there's contact information here for recent recent care coordination services. So here highlighted, we have this person is enrolled in a health home, began earlier this year. You can see they're still active, and then you can see the main contact referral information and the referral number and the downstream care management provider that they're enrolled in. So health home information is captured within the current care section if it's more recent. This person, you can see, also has had homeless services at the top. So you can see they had a homeless stay back in September and the main contact information there. They're also currently in AOT, and you can see the AOT enrollment and expiration date. The housing and residential program information as well, coming from CARES. Now below the current care section, we have our notifications section. So these are more so like eligibility messages. So I highlighted here the Health Home Plus eligibility message that you would see if a client meets any of that PSYCKES algorithm Health Home Plus eligibility criteria. Now this message in the clinical summary is updated on a monthly basis, so just something to keep in mind. Along with that, you can see if they meet complex needs criteria or if they're core eligible here, or if they have a Medicaid eligibility alert, or if they're high mental health needs. So a lot of different information can show in these two sections. And the brief overview can be exported just to PDF. Now, when we switch over to the full summary view, like we're showing here, you can export to both PDF and Excel. I went through these sections already, so I'm just going to keep scrolling down the clinical summary. And now we're on the alerts section. So the alerts could show anywhere from homelessness information to suicidal ideation or self-harm or opioid overdose information from all time. So even if, for example, a suicide attempt occurred over 10 years ago, that would still show in this section in the application. So here you can see the alert type, the number of events, meds or positive screens. If they've had, for example, a positive PHQ-9 or CSSRS, that would show in the alert section. Then the first and most recent dates, the provider name along with the program name, and then the severity, diagnosis, meds, or results. So again, if a PHQ-9 or CSSRS was positive or high risk, you could see the diagnoses in that right-hand column. And you can also drill into the alerts and see more information like the data source if it's available. And then we're going to scroll down to the SDOH, Social Determinants of Health section. Again, these are reported just in billing at this time using Medicaid billing Z codes. What you can do here is you can click on a specific SDOH condition, like we are doing right in this example. We've clicked on homelessness, and it'll show you when that SDOH condition was indicated in billing. So you can see the date of service, the service type and subtype, along with the provider name, and then lastly, any other diagnoses that went along with that bill. And then scrolling down further, we have the quality flags section. So here at the top, this is just a reminder that this is updated on a monthly basis. And we have that definitions hyperlink there again. I've highlighted here those eligible for Health Home Plus measures. So this person meets most of the Health Home Care Management adult indicators, including a lot of the eligible for Health Home Plus indicators. So what you can do is you can click on these just to see a brief definition of them. We also have in the upper right-hand corner the ability to toggle from a graph to table view. So you can see how long somebody's been meeting criteria for a specific flag. Again, these are based on our PSYCKES algorithm and DOH map, and they're updated monthly. So sometimes you might see that a person has these eligible for Health Home Plus quality flags, but they don't have that notifications message, and that might be because they're being pulled in to Health Home Plus eligibility from MAP alone. So sometimes there might be a slight discrepancy between the notifications message in here, and that's just due to what we're pulling in from the PSYCKES algorithm versus MAP. Then scrolling down, we have our diagnoses section. So behavioral health and medical, you can click on a diagnosis and see when that diagnosis was given. So here we've clicked on schizoaffective disorder, and you can see the date of service, the service type and subtype, the provider name where that diagnosis was given, and if any other diagnoses were also included on that claim. In these drill-ins, you can also export to PDF or Excel. All right, this is the care coordination historical section. So I previously went over the current care coordination section. Those are care coordination services that someone's received in the past year. And this section we're looking at now is the more historical view in the past 5 years. So you can see any other care coordination services this person has received. So they've had AOT, they were enrolled in a health home. They did receive Health Home Plus services at one point, but those ended in 2024. They've had jail-based care and ACT services along with IMT services. So what you can do here is drill in and you could see if applicable from billing, you could see the practitioner information. And then we have our medication section. So we have controlled substances, behavioral health, and medical. What you can do here is you can toggle to the graph view to see somebody's medication utilization. If you want to see if there's any patterns in that, you could also drill in to see more information on the pickup dates, the brand and generic names, the strength, the quantity dispensed. You can even see the pharmacy that the medication was picked up at by drilling in further. All right, and then behavioral health services. So here you can see information on what other types of behavioral health services somebody has received, like core or HCBS services. Pros would show here, ACT, CCBHC services. So you can see the service type in the left-hand column, the provider that gave that service, the first and last dates billed, and the number of visits. You can see the most recent primary diagnosis associated with that service and the most recent procedures. And if you drill in, you can see a little bit more information to see if there's any other diagnoses that accompanied that specific service as well. Then we have crisis services. So again, very similar to the behavioral health services section, you can see the service type. So in this example, this person had crisis stabilization center services. You would see crisis stabilization center intensive or supportive if they received those services here. Residential crisis support, mobile crisis, and CSIDD, which is crisis services for the intellectually and developmentally disabled. So you can see the service type, the provider information, the first and last dates billed, and the length of stay, the primary diagnosis associated with that crisis service, and then the most recent procedures. And then finally, I will go over the hospital ER services section. It's very similar to the other two. The service type will show if they've had an ER or inpatient stay based on substance use information, mental health, or medical cause. Just to note, if you only have verbal consent, for example, you wouldn't be able to see the substance use information here, and it would show as ERBH, combining the mental health and SU categories. So you can see the service type, the provider, the admission and discharge dates, along with the length of stay, their most recent primary diagnosis, and then their procedures during that ER inpatient visit. And if you drill it, again, you can see all the other diagnoses, if any, associated with that specific hospital or ER service. All right, I think we're on to the last section in today's training, My QI report. So My QI report is a tool used for managing quality improvement efforts, and it's updated on a monthly basis. So I want to just go over the eligible population, which is also the denominator. This includes clients or episodes, plus any other parameters depending on that quality indicator specifications. So what I recommend if you're ever wondering what the definition or inclusion criteria is for a certain measure, we have our quality indicators page on our PSYCKES website. That includes most of our PSYCKES run measure specifications that you can reference, or you can always reach out to our help desk with any technical specification questions on the measures you're looking at. So that's the eligible population or the denominator. Then we have the number with QI flag, that's the numerator, and that's clients or episodes that meet that flag's criteria. So we take the numerator, the number with QI flag, over the eligible population, the denominator, and we make a prevalence rate. And what we do is we compare the prevalence rate for your agency against the region and statewide prevalence rates. And in my QI report, you can also filter by program type. So, for example, you can filter by folks who are Health Home enrolled or Health Home Plus enrolled or CMA enrolled, or you could filter by client residence or region or county for the provider location. We also have a population filter where you can filter by the complex needs population. And then something that might be useful for the work you do is the Health Home Care Management Sites tab, and that breaks out the QI prevalence rate by health home or CMA. So I'll show what that looks like. And here you can drill down to a list of recipients who meet criteria for a specific flag, and you can export these reports to Excel or PDF. Now we have a slide here just to help with the understanding of my QI report. So there's a way we attribute clients to an agency's MyQI reports, and that's through billing, which is clients linked to your agency if they've been billed by your agency in the past 9 months, or they can be linked through MAP. And this is clients who are linked to your agency if they're enrolled in the health home or CMA or according to MAP. And that's really used to help keep these reports current and make sure current clients are included on your report each month. So that's how clients are attributed, if they've been billed by your agency in the past 9 months or if they're currently enrolled in your health home or CMA according to MAP. Now, the period of observation for the quality indicator, it differs by measure. So for example, the look back period for the high utilization quality indicators is 13 months. So that's just something to keep in mind that we link based on the past 9 months or current enrollment in health home or CMA according to MAP, but the period of observation for the quality indicator, it differs by measure. So again, that's why we always recommend double checking those technical specifications. All right, this is my QI report. So in the purple navigation bar at the top, I went to the My QI report option, and here I'm logged in as Main Street Health Home. Now we've recently updated our QI report screen. So now you can see there's two different tabs at the top. There's the quality improvement tab, and those are more real-time PSYCKES run measures. They're as of 10, well, they will be as of 10/1/25 next week. Right now they're as of 9/1/25. And these are more real-time to help rapidly address current quality improvement concerns. We also have the performance tracking tab to the right, and those are our DOH run measures. They're as of right now 12/1/24, and they're intentionally run with a 6 or more month lag to allow for complete data to come in. So that's the difference between the two tabs. The quality improvement is a bit more real time, and then the performance tracking tab has a 6 or more month data lag. So our quality improvement tab, that's the one we're on right now. I just want to go over the different columns you see here. So you have the indicator set name, the population. So that's the population that could be included in any of the indicators within that indicator set. Then the eligible population/episode, that's the denominator. The number with QI flag is the numerator, and then we turn that into that prevalence rate, which is where that purple square is. And that prevalence rate is your agency's prevalence rate, and that's compared on the far right against the regional and the statewide prevalence rates. So in my QI report, you'd want to see your prevalence rate go down over time and be lower than the region and statewide prevalence rates. The lower, the better for the PSYCKES application, which might be different from other applications. So here you can also go to the filters box on the top right of the screen. So if I click that, this filter box pops up, and here I can filter by program type, managed care plan or product line, age group, population. Again, you can search by all or complex needs population. Then there's client residence or provider location, region, or county. So in this example, we're going to use the program type option, and I'm going to see who is care management enrolled according to MAP that I serve that meets criteria for any of these quality flags. So when I apply that filter, my numbers change um, and just look for those that are care management enrolled according to MAP. So now I want to drill into the health home care management adult indicator set. So when I drill in there, that's where my eligible for Health Home Plus quality measures live. And again, this note is here. I know I've said it a lot of times during this webinar, but just as a reminder, these are based on our algorithm and map, and they're updated monthly. So here I can see there's 759 individuals that are considered Health Home Plus eligible based on our PSYCKES algorithm or map. Now, out of those eligible individuals, it looks like 227 have not received a Health Home Plus service in the past 3 months. So if I drill in, I can see in the recipients tab those 227 individuals. If I have the appropriate consent or emergency access, I can drill into their clinical summary. If I don't have access, I could either enable access within my QI report if I have it. Um, I could even export this to PDF or Excel if I'd like, just to have a list of the recipients that meet criteria. And it's just important to remember the filter that I put on. So these are Main Street Health Homes clients that are linked to Main Street Health Home through billing in the past 9 months or through CMA or Health Home enrollment in MAP. And I filtered just for my care management enrolled individuals. So out of those care management enrolled individuals, these are the folks that haven't had a Health Home Plus service in the past 3 months that are eligible for that level of service. And then I'm going to move over to the Health Home Care Management Sites tab. So here, since I'm logged in as a health home, I can see the Sites tab is broken down by all of the CMAs and my health home has the downstream care management CMAs that I'm a part of. So I can see the site name and the address. And then to the right, I can see for that specific site who the eligible population is. So in the first row, I can see that there's 69 Health Home Plus eligible individuals at ABC agency based on our algorithm or map, and 24 of those individuals have not received a Health Home Plus service in the past 3 months. So I could even sort this by ascending or descending the number with QI flag, or maybe I want to look at a site that has a higher prevalence rate to work with them on lowering that number. So here you can click on the site address and drill in and actually see the specific recipients at that site that meet criteria for this quality flag. And these can be exported to PDF or Excel as well. So now I'll go into training and technical support. If you have any questions for the Health Home Plus Tableau, you can reach out to the Data OFI Help Desk. So they're available 9 to 5, Monday through Friday at dataofi@omh.ny.gov. And then for PSYCKES, we do have a lot of resources on our public website, psyches.org. But if you have any questions regarding our application, you can absolutely reach out to us. We're available also 9 to 5, Monday through Friday at psyches-help@omh.ny.gov. And then I have one more slide about issues with your token or logging in. If you have any issues with either of those, you can contact the ITS help desk if you're an OMH or state employee. We have the chat link there along with the phone number. And if you're a non-state or non-OMH or non-state PC employee, you can either call the 474 number at the bottom or email healthhelp@its.ny.gov. But if you're ever not sure, always feel free to reach out to our Psyches help desk and we can um, help resolve your token or login issue as well. Okay, now we're on to the Q&A portion. So I will pause here and touch base with Melanie to see if any questions have come in.
Michelle, yes, we did have a lot of great questions come in, most of which we've been able to answer in Q&A, but I think they are worth asking on air because they may be very helpful for the rest of the group. But the first question is the Health Home Plus Tableau dashboard available to all Psyches users, or is that something that needs to have a special request?
That's a great question. That is available for all Psyches users at this time. So that would not need a special request.
Great. And then our next question is, how can someone get access to Psyches?
That's a great question. So Psyche's access is managed by your organization's security manager. So if you're not sure who your security manager is, you can reach out to, I'll put our help desk information up, our Psyche's help email, and we can let you know who your agency's security manager is. So what you do is you reach out to your security manager and they'd add you into the security management system, granting you access to Psyche's Medicaid. And then you'd get a console email and containing your user ID and password. And that's how you get access is through your agency's security manager. So if you're not sure who that is, you can absolutely reach out to us and we can provide those steps.
Great. Okay, the next question that just came in. Does this information only apply to clients with Medicaid? What if the client had a gap without Medicaid? Will the information not be in the clinical summary?
That's a great question. So we do have non-Medicaid clinical summaries that include like state PC information or information from other state databases. But if somebody did have a gap in their Medicaid coverage, I think there would be a gap in the data that we're receiving. But there is a data lag, so if anything was covered before or after that, I think it would just take a little bit of time to show up in our application.
Okay. Another question we had was related to the health home consent. So if a consent is obtained and the client is still enrolled and billing with the CMA or health home, is it necessary to obtain a new psyche's consent, or does the original consent work?
Yeah, that's a great question. I think if I'm understanding it correctly, the DOH consent would remain active as long as the client was enrolled in the health home or CMA according to MAP. So if I think that's what the question was asking. Um,
Yes, I
okay,
believe that is the question. So
exactly.
yeah. Okay. And then another question similarly related to the health home consent. Once the health home consent is obtained, how is that form used in psyches?
So, just to clarify, you never have to upload a consent form into Psyches, like a copy of it or anything. You would just go to, let me go back in my slides, to the Enable Access module. So once the DOH Health Home consent is obtained, you would locate that person in the application. And when you're enabling consent, you would just check off the Health Home patient information sharing consent option here. Again, this option will show if you are a DOH Health Home or MAP recognized CMA, or if you're a CCO. And if it's not showing for you, I would just double check that your user role profile shows the appropriate options selected, like the health home administration or the care management option. Once those two requirements are met, then this option should be clickable for you. I hope that answered the question.
Yes, it actually answered two questions, so that was perfect.
Oh, great.
Um, Yeah, and just to add on to that, if there is any confusion, if the agency is or DOH recognized CMA or health home, and your user role profile settings seem to be set correctly, but you're still not seeing the checkbox, you can always email the Psyches help desk, and we can look into that further to see if there's any further issues in the application. I believe that covers all of the questions. Maybe we'll give it another minute, see if anything new comes in. But that is what I'm seeing right now.
Okay, go back to our technical support slide. Oops, let me go back here. And if anything comes up after the fact, we can always help via our help desk as well. We usually respond within 1 business day. Oh, I think I saw another one come in. Maybe not. Did I see another one?
I think we may have gotten one in chat. When will this training be held again? I would like my behavioral health team to be able to take advantage of the training.
Well, that's a great question. So we don't have any plans to hold this again in the near future. However, we have recorded this and we have the slides that we'll be sending out to everyone afterwards and posting it to our website. And when we do offer this training again, we will make sure to notify all of our users in our Psyches listserv. So just keep an eye out for next quarter's training webinars and beyond that. So more to come, but this one was recorded and the slides will be sent out.
And then I do see one more. How do we submit a ticket in Psyches to answer questions regarding Health Home Plus eligibility?
So there's not necessarily a way to submit a ticket. What we always recommend is just reaching out to our psyches-help@omh.ny.gov email address. If you have a question about someone's Psyches Health Home Plus eligibility, feel free to send us an email and then making sure you're using your agency's protocol regarding PHI. It's very helpful to also have that person's Medicaid ID so we can also look at what you're talking about and investigate further with our data analysis or IT teams if needed. So feel free to reach out to our email for any of those types of questions.
And one more, this is kind of similar to what you just mentioned, Michelle. What can we do if we know that information is incorrect, such as someone no longer being homeless?
That's a great question. So, with the homelessness criteria, I'm glad somebody brought that up actually. We are looking into refining that criteria further. We are aware that there are instances where somebody might not be currently homeless, but is showing that DHS shelter information in their clinical summary, thus triggering the new Health Home Plus eligibility homelessness criteria. So, that's something we're looking into further on how to refine that to make sure that there aren't any false positives showing in the application. But please feel free to reach out to our Psyches help desk with that instance, just so we can look into it further in case there is an explanation for it or if it's something that we'll be updating in the near future. All right. Was that the last of the questions?
I believe so. I'm not
So,
seeing
okay.
anything new.
Okay. All right. Well, that is the end of the webinar then. Please always feel free to reach out to us with any types of questions that you have about the applications. I really appreciate everyone's time today, and we will be following up shortly with the slides and recording link, and I hope everyone has a wonderful rest of your day. Thanks for joining.